Questions 301 to 320. 301. When would the nurse schedule a woman for a glucose tolerance test? A. 6th to 10th week of pregnancy. B. 12th to 16th week of pregnancy. C. 24th to 28th week of pregnancy. D. 32th to 36th week of pregnancy. The answer is C. 24th to 28th week of pregnancy. 302. A newborn has a diagnosed developmental dysplasia of the hip, DDH, and is using a Pavlik harness as treatment. Which of the following mechanical factors is associated with DDH? A. Intrauterine breech position. B. Caesarean section. C. Small infant size. D. Single fetus. The answer is A. Intrauterine breech position. 303. The relative of a 25-year-old postpartum patient stopped her from taking bath until the 40 days provided with the food by the family that was of saturated fat and a liter of reduced full asking. She said the diet was good for the milk. Which of the following should be the prioritized patient's understanding about? A. A healthy and balanced diet is beneficial. B. Breastfeed is not affected by mother's diet. C. Maintaining personal hygiene is most. D. Rest and relaxation is necessary to regain. The answer is C. Maintaining personal hygiene is most. 304. When is the ideal time to administer analgesia to a woman in labor? A. As soon as she requests analgesia. B. When labor is well established. C. When the woman enters into transition phase. D. When the women progress from latent to active phase. The answer is D. When the women progress from latent to active phase. 305. A patient height is 183 centimeters and weight is 63.5 kilograms, BMI 19. What is the patient weight classified as? A. Underweight. B. Normal. C. Overweight. D. Obese. The answer is B. Normal. 306. Which of the following would the nurse included in her discharge education for a postpartum patient regarding signs and symptoms that should be reported immediately? A. Lochia rubra persists. B. Nipples become red. C. Lochia decreases in amount. D. After pains increase with breastfeeding. The answer is A. Lochia rubra persists. 307. Every how many minutes to check fetal pulse with second stage of labor? Every. A. 5 minutes. B. 10 minutes. C. 15 minutes. D. 20 minutes. The answer is A. 5 minutes. 308. When the nurse assessed the fundus of a multiparous mother who delivered 2 hours ago, she found the following level: 2 centimeters above the umbilicus. Position: deviated to the right. Consistency: not well contracted. What is the next nursing action after massaging the fundus until it becomes firm? A. Assess vital signs. B. Increase V fluids. C. Evacuate the bladder. D. Ask the mother to rest. The answer is C. Evacuate the bladder. Mastitis, caused by blank. The answer is E. Coleus streptococcus, and V. aureus. 310. A nurse is providing instructions to a mother who has been diagnosed with mastitis. Which of the following statements, if made by the mother, indicates a need for further teaching? A. I need to take antibiotics. And I should begin to feel better in 24 to 48 hours. B. I can use analgesics to assist in alleviating some of the discomfort. C. I need to wear a supportive bra to relieve the discomfort. D. I need to stop breastfeeding until this condition resolves. The answer is D. I need to stop breastfeeding until this condition resolves. 311. A primiparous mother who has mastitis is asking the nurse feeding which of the following would be the proper nursing response to the organism of mastitis? A. It will not affect the newborn. B. It will be deactivated by salivation. C. It will not be expressed in breast milk. D. It will be killed by immunoglobulins in breast milk. The answer is A. it will not affect the newborn. 312-41 A nurse is giving health education for a mother who has mastitis. Which of the following, if stated by the mother about what she needs to do, indicate that additional education is needed? A. Take antibiotics. B. Use analgesics. C. Wear a supportive bra. D. Stop breastfeeding. The answer is D. Stop breastfeeding. 313. A 23-year-old vaginal delivery primigravida mother was discomfort due to breast engorgement on the second post. The mother complained of pain on the breast side and the able to suck the milk. Which of the following will relieve the mother's discomfort? A. Breast binder. B. Well-fitting brassiere. C. Encourage breastfeeding. D. Lactation suppressing medication. The answer is C. Encourage breastfeeding. 314. The nurse was planning care for a 25-year-old primigravida postpartum mother who had engorgement due to poor feeding technique. The left breast appeared red and swollen and was diagnosed as which of the following is the best education for the mother? A. Avoid wearing brassiere. B. Begin suckling on the right breast. C. Stop pumping milk from the left breast. D. Take antibiotics till the soreness subside. The answer is D. Take antibiotics till the soreness subside. 315. After 3 days of breastfeeding, a postpartum patient reports nipple soreness. To relieve her discomfort, the nurse should suggest that she A. Lubricate her nipples with expressed milk before feeding. B. Dry her nipples with soft towel after feeding. C. Apply warm compresses to her nipples just before feeding. D. Apply soap directly to her nipples, and then rinse. The answer is C. Apply warm compresses to her nipples just before feeding. 316. The nurse is teaching a newly delivered mother about breastfeeding. Which of the following statements indicates that the mother needs further teaching? A. I will empty my breast and use an alternate breast at regular intervals. B. I will take a daily shower and clean the nipples. C. I will let my nipples dry after feeding to prevent nipple tenderness. D. I will always wear a supportive wireless bra. The answer is A. I will empty my breast and use an alternate breast at regular intervals. 317. Mastitis is an infection of the breast that occurs most often 2 to 4 days after childbirth. Which of the following is considered first-line treatment of mastitis? A. Drainage of breast abscess. B. Antibiotic therapy and cessation of breastfeeding. C. Antibiotic therapy and continuation of breastfeeding. D. Advise mother to stop breastfeeding until infection is clean. The answer is C. Antibiotic therapy and continuation of breastfeeding. 318. A 30-year-old primigravida postnatal mother come to the clinic on the she complained of feeling shivering, redness, swelling and pain in her right blood pressure 90-60 seconds, millimeter of mercury heat 84 per minute, respiratory rate, temperature 38.8 degrees Celsius. Which is the most common organism that causes mastitis? A. Pseudomonas. B. Escherichia coli. C. Group B. Streptococcus. D. Staphylococcus aureus. The answer is D. Staphylococcus aureus. 319. The nurse is teaching a 32-week pregnant woman how to distinguish between pre-labor, false, contractions and true labor contractions. Which statement about pre-labor contraction is accurate? A. They are regular and increase gradually. B. They are felt in the abdomen. C. They start at the back and radiate to the abdomen. D. They become more intense during walking. The answer is B. They are felt in the abdomen. 320. Azithromycin is prescribed for an adolescent female who has pneumonia and recurrent chlamydia. What information is most important for the nurse to provide? The A. Use 2 forms of contraception while taking this drug. B. Have partners screened for human immunodeficiency. C. Decrease intake of high-fat foods, caffeine, and alcohol. D. Report a sudden onset arthralgia to the healthcare provider. The answer is A. Use two forms of contraception while taking this drug.